Ultimately, my hope is that the blueprint, along with some of the additional resources provided with it, will be helpful in bringing these new therapies closer to home for all of our patients and be able to contribute to improving the access to care for this emerging drug class.
That's Dr. Donald Moore, a pharmacist at Atrium Health Levine Cancer Institute. You'll hear more from him up next. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Bispecific antibodies have the potential to transform cancer treatment, and they're becoming more widely available in community practices. To help oncologists make this therapeutic option available for their patients, ACCC built a comprehensive blueprint. Dr. Donald Moore is a pharmacist at Atrium Health Levine Cancer Institute.
This blueprint is really trying to create a means of how the community oncology practices can successfully provide these newer bispecific antibodies to their patients and how they can best collaborate with other, perhaps larger or academic centers that can have certain infrastructure to handle the initiation of bispecific antibodies. It's a blueprint, it's a guide, it's a tool that can help different practices trying to onboard bispecific antibodies as to the role each person on the care team can play. And while we've seen these new therapies could have a high degree of response rates and have additional treatment options for patients with various cancers such as multiple myeloma, lymphomas, and now also small cell lung cancer, they can be quite challenging to be able to initiate because of those aforementioned toxicities, CRS and neurotoxicity, and the need for hospitalization for monitoring, which then lends itself to having to have certain types of infrastructure in place. So really, the hope here is that this blueprint will be significant in providing centers with a guideline and a resource on how to best navigate being able to provide these newer therapies to their patients.
Share with us what's outlined in the blueprint.
In the blueprint, there are a few key pillars of roles and responsibilities outlined, and then there are a number of really specific activities listed under each pillar. So there's two major facets in the blueprint: capacity building and care coordination. So capacity building relates to things such as developing the appropriate infrastructure to provide these therapies, ensuring there is sustainability in the practice, educating providers, and ensuring access to care for patients. So appropriate infrastructure is going to include things such as if a practice is going to have the capabilities of providing both the step-up doses and the maintenance doses of bispecific antibodies or just the maintenance doses. It's going to also include the capacity to handle REMS programs, risk evaluation mitigation strategy programs, for the therapies that do have that on their label, as well as the capacity to build order sets, any sort of remote monitoring for patients and providing outpatient bispecific step-up doses, etc. The second major set of roles and responsibilities really relates to coordination of care and the management of adverse events. So some of the key players here is going to be navigation. So navigating the coordination of care if a patient is going to need to, start at a larger center and then come back for their maintenance doses closer to home. Patient and caregiver education is going to be very critical here as well, as obviously they need to be educated on what to expect with therapy, the different types of adverse events, and when to seek medical attention. Also, how patients are monitored, triage, and adverse events managed. And some of the key primary players there are really going to be members of the clinical care team, whether it be physicians, pharmacists, APPs, or nurses. So I think that all those different types of roles and responsibilities, and then some really specific types of activities to be able to meet that type of criteria is pretty well outlined in the blueprint, and also really helps to outline who might be the best person on the care team and in a practice to be able to take the lead on those different types of activities, as well as those who might be able to, influence, advise, or, assist with those different types of activities listed out.
How does the blueprint address the relationship between academic and community cancer centers?
So I think one aspect of the bispecific antibodies has been pretty well underscored with their arrival into our therapeutic space in hem-onc is that there are centers that really need to have the capacity and infrastructure to effectively initiate these therapies because of their unique and acute adverse events that can occur typically during that initial phase of treatment. So this has led to the need for a lot of community centers to essentially partner with larger or academic cancer centers that have said capacity, infrastructure, as well as potentially even experience with these drugs and their toxicities. So, one thing that we've seen with the advent of these therapies is having that relationship between centers is going to be really critically important to ensure that we are, effectively managing and treating these patients in a very collaborative manner. So one thing I think that the blueprints highlights very nicely is what each side of that partnership can do and should be doing to be able to effectively co-manage a patient who needs one of these newer therapies. It can really help to solidify expectations across the board for what the community cancer centers teams will do for the patient relative to what the academic center will be doing for the patient, and when the patient will be able to go back to their community center. So the coordination of care for patients moving between institutions can be sometimes quite cumbersome and difficult. Things can unfortunately sometimes slip through the cracks. And I think that the blueprint really nicely describes and delineates some of the high-level roles and responsibilities of a community academic partnership and how both sites can collaborate to deliver care to their patients.
How can community centers start using this?
So I think the most immediate way that providers and practices can leverage the blueprint is that it gives them a tool and a framework to really approach their team at their practice with. So for any community cancer center that's looking to make bispecific antibodies available, the blueprint can be the spark that starts that conversation. What we've learned is that it takes a lot of different people being involved at the table to be able to make bispecific antibodies happen, whether it's in a community center or even at larger centers as well. It takes a lot of coordination for these different types of therapies. And all the different steps and activities, they need to be evaluated. And that's what the blueprint really helps to do. It's going to let a provider champion know who needs to come to the table, all the different steps and activities that need to be evaluated and occur, and how the various marching orders can be delegated to various members of the team so that you can have a very effective team-based approach to being able to successfully provide these new therapies. These new therapies, sometimes they can be a bit daunting for different practices to be able to onboard because of some of their logistical challenges. And I think that what the blueprint really nicely tries to do is to give you a starting off point so that you have a framework to get the conversation going and provide direction to any practice to be able to successfully implement these new therapies.
What are some of the challenges that community cancer centers face?
So common challenges I've seen in practice includes coordinating care between institutions, sometimes differences in formularies between centers, and then just education for various teams. So care coordination can be challenging when patients are transitioning back and forth between two practices. And I think that the blueprint, again, gives a great framework on how to navigate that efficiently. So it provides a nice, infographic on what a community cancer center can do versus what the academic center can do, as well as who to bring to the table at your practice to be able to help the navigation of patients moving through our complex healthcare system. Education is also really critical with onboarding bispecific antibodies. And I think that as more and more clinicians become educated on this drug class and understanding the timing of toxicities, this will in turn help with the success of ensuring that T-cell engaging bispecific antibodies are going to be more widely available in community cancer centers. And one thing I've heard in practice that can be a bit challenging is some of the misconceptions as to when patients may be able to safely transition care closer back to home after receiving their step-up doses at a larger center. And I think that the blueprint and its high level of emphasis on provider education really helps us showcase that more education will go a long way and hopefully will lead to patients being able to transition care back home in a much more timely manner.
Is there support beyond the blueprint?
So along with the blueprint, we've also included a nice resource library of some other different types of resources. One is a great paper from colleagues of mine, fellow pharmacists at other cancer centers around the country, who recently wrote an excellent paper published in the Journal of the Advanced Practitioner in Oncology that really helps to navigate this drug class and being able to optimally manage improved access to care. There's also a couple other ACCC initiatives related to bispecific antibodies, including Project ECHO, and also a nice resource on trying to expand access to cellular and bispecific therapies. That can really be found in the end of the blueprint with links provided. And I'd encourage anyone who's looking to onboard these therapies to also utilize those resources as a nice supplement to the blueprint and able to educate the care team at your practice.
How important is multidisciplinary collaboration here?
So I think the blueprint really nicely highlights that to bring bispecific antibodies to a practice, it really takes a village. And there seems that everyone can play a role. So whether it be the treating hematologist, oncologist, pharmacists, nurses, ABPs, and also senior administration, patient navigators, financial clearance teams, the blueprint breaks down all of the various types of activities that really goes into successfully onboarding and sustaining a practice that provides these therapies and really helps to roadmap who does what on the team in order to make all of this happen. So it also helps to determine who should take the lead on a very specific type of activity, as well as who can contribute to that activity. And I think that these important distinctions are that members of the multidisciplinary team have clear expectations on the capacity by which they're contributing to this effort. And I think once you have those clear expectations that are really well highlighted in the blueprint, that's how practices are going to be able to be successful with onboarding these new therapies.
Talk to your colleagues across the country who are hoping to improve their approach to bispecific antibodies.
So my key takeaways from this are that there's a lot that goes into being able to provide successfully T-cell engaging bispecific antibodies in any practice. And that being said, these therapies are not only here to stay, but there's certainly going to definitely be more of them across the continuum of hematology oncology. And so now is really the time to be able to get on board with being able to provide these therapies. And I think that the blueprint is really there to help navigate this initial challenge with these therapies being so new to all of us. So I think for any practice looking to provide these therapies, the blueprint is immediately actionable, as it certainly can be something that starts the conversation, as I mentioned previously. Ultimately, my hope is that the blueprint, along with some of the additional resources provided with it, will be helpful in bringing these new therapies closer to home for all of our patients and be able to contribute to improving the access to care for this emerging drug class.
Thank you, Dr. Moore. Take a look at the show notes for a link to the blueprint and more resources on implementing bispecific antibodies. And take a second to tap the plus icon on your podcast player to follow the show. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.